Welcome back to Tech Talk with Craig Peterson. We're talking about some of the technology you can use through the summer and, of course, through the rest of the year as well. And right now we're going to talk a little bit here about healthcare. That's a topic that, of course, has been in the news a lot lately. So we are going to be joined by the CEO, president, and co-founder of PINGMD. That's where you'll find them online, pingmd.com. You'll also see it in the Google Play Store and the Apple App Store as well. And we're going to talk a little bit about what they're doing and how it can really help with your healthcare as well. Gopal Chopra is our guest. Gopal, welcome to Tech Talk with Craig Peterson.
Thank you very much, Craig.
So let's talk a little bit about this. You've got this put together now. What's PINGMD about, and why did you help found it?
So what was interesting in healthcare, and I'll give you the perspective of myself as a physician and wife as a physician, we were struggling to communicate with our patients, and patients were really anxious about getting an opinion but finding us unavailable. The interview time with a patient is now down to 7 minutes as a national average, and the patient ends up looking up Dr. Google or going to the emergency room. And that became a real problem. They wanted our advice, and we were just unavailable. And so my wife couched it as the spillover effect, because if we had more time, they wouldn't need to go anywhere else. So we really thought about how physicians make themselves available, what information they need to give advice, and thought of a very simple database solution app for you to contact your doctor.
So you're providing some facilities here that are going to help the patient and the communication with the doctor, as well as the doctors. You also on the website here have some information and ties for healthcare providers. So how far into the relationship are you going, and what kind of an interface are you providing to the patients, to a doctor or their doctor?
So very simply, the patient tries to describe their problem, and they'll try it on email or give a call to the office, leave a message. What we have done through our app is allow for the patient to tell us what the problem is. The app then intelligently asks them for some details, simple questions of how long it's been there, where it is, and they can even put picture and video. And that is just priceless for a physician. It's more efficient getting the information in this format. Our office deals with it a lot quicker. And if we need to seek an opinion from a colleague or a specialist, then we can engage them with information as opposed to leaving another message, which, it's funny, but doctors struggle to find doctors as well. And we're trying to get all of these opinions and help the patient make the care personalized. But the phone tag is getting in our way, and we're busy, and we're not adapting to the technology available. So PINGMD has brought the technology to the hands of the patient and the doctor and their colleague to make that communication simple.
Well, let's talk about the other side that I introduced the concept with here, Gopal, which is the improvement of healthcare. If someone is able to basically go online, right, and describe their symptoms, describe their problem, have that sent to their own doctor, assuming their doctor is part of the healthcare provider network that's tied into PINGMD, they're going to get a better diagnosis. You mentioned tying into maybe a larger network of doctors or specialists if your doctor has a question or a problem. Is this something that really could make some major inroads in improving healthcare?
Absolutely. I think when you look at healthcare and realize that a lot of it is about collaboration. We are collaborating with our colleagues, whether it's our nurse practitioner at a patient's home looking at a particular problem, or it's our specialty physician gastroenterologist that we need to consult with. And then we're looking at the continuity of care. That patient record needs to be shared amongst the community. We can't just have, notes, sticky notes or messages left that aren't recorded that we can refer to. So to collaborate, to personalize, to navigate, we need a better system because, as you point out, it is a community. It's a community for the patient, and it's a community for the doctor. And all the healthcare professionals, nurses, physician assistants, residents, we're all consulting each other to say what's the next best step for this patient. And to decide on that, we need specific information. So we simplify that information. We bring pictures and video, which, as a surgeon, I've been using for a decade, but we don't have a very simple or succinct way to do it today. We need a way that pictures and video become part of your record.
Pulling it all together, PINGMD. You can go online to find out more. As I mentioned, you can grab the app from the Google Play Store, from the Apple App Store as well. And the whole idea here is that patients and families can get your doctor's advice right in the palm of your hand, get answers, don't sit in the waiting room for hours. This should save time not only for you, but for your healthcare providers, and it really should make things quite a bit better. Gopal, anything else you'd like to add? We've got about 30 seconds left.
Thanks, Craig. I think, PINGMD is really about bringing convenience and trust back to the healthcare relationship.
Something that has definitely been missing, and is probably going to be missing more in the future, so we can get things like PINGMD well grounded into the healthcare system. PINGMD, PINGMD.com. Stick around. We got more Tech Talk with Craig Peterson coming right up.